My name is Kristen Keller. I did my presentation on Chapter 12, Nutrition Through the Lifespan, Later Adulthood. Getting old for the birds, and I don't wish upon them either. It's just something a patient I used to work with used to say a lot. Just reminds me of later adulthood. Healthcare is changing, so get with the flow or retire. It doesn't mean like you should retire because you're not up with the times or whatever, but the way that healthcare is changing, the way that you're going to get paid is starting to change with the way Medicare will reimburse. Like if people keep coming in for the same problems and they're not getting treated or cured the best that they can, your Medicare is going to stop paying the hospital, and so you're going to stop getting paid too. So you want to be up with the best way to deal and treat with later adulthood in nutrition. So 65 is the new middle age, 78 is the new old, and 85 is the most popular club in town. The book was referring to that as what people think of as an older adult isn't like as old as people once thought. 85 is the most popular club in town. People are living longer. You need to be able to research how they're aging, what the best ways to help them age is. A lot of the research is going to genetics, age, environmental factors. They can be predisposed positions, but your nutritional health and the way that you can educate your patients on the nutrition and what it could benefit or help their disease processes is what you want to keep them going and keep their longevity up. So nutrition and disease prevention. This was just one of the charts in the book. Energy intake helps to prevent obesity, diabetes, and cardiovascular diseases. Adequate essential nutrients prevent deficiency diseases. Moderation of sugar helps prevent dental diseases. Adequate fiber helps prevent constipation. And calcium intake helps prevent osteoporosis. All things that we know, but people may have had a bad diet their entire lives, and they don't understand the benefits of starting a new routine now, and how fiber can help with a lot of the elderly. They're on medications that will make them constipated. So increasing your fiber is not only going to help your constipation, but it'll just make their life more comfortable. And that's something that I think people don't really understand, but people don't also talk about it enough to help the patient. Okay, so they're getting older. Tell me more. I just looked at a couple of the conditions that were with older adulthood. Weight affecting the bones, having to carry excess poundage. So for arthritis, you're carrying that extra poundage around, you know, emphasizing the benefits of losing weight. When I was younger, I had an infection, and they told me that I would be more likely to have rheumatoid arthritis when I was older. So like my knees hurt and stuff, and I used to tell my mom, no, I don't want to do anything because my knees hurt. But exercise isn't the enemy. It talks about quackery in the book, just saying that some nutritionists or people want a fix-me-now cure. There isn't a cure for arthritis, but educating on the benefits of eating the certain vitamins, your diet, exercise is good for arthritis. I'm up, but I don't know about Adam. This is a cognitive slide emphasizing how the vitamins in your body act on the neurotransmitters for the amino acids, such as tryptophan that we had talked about. Nutrient deficiencies may contribute to loss of memory and cognition. it talks about plaques and tangles and Alzheimer's, the association. I personally don't agree with that at all based on studies that I've read saying that they're going away from plaques and tangles being as associated with Alzheimer's disease as they had thought. But with Alzheimer's disease and losing the cognitive functioning that you lose when you don't have a good nutritional outlook, you might forget to eat. You're not going to get all the vitamins that you need. They were talking about the determined checklist and eating by yourself, social contact. A lot of elderly people, they forget that they're, or Alzheimer's people, they forget that they're hungry or that they didn't eat. Their sensations of what they like change. Food might smell differently. They can't smell sometimes if something is rancid or rotten. So they need help knowing how to identify things like that. So vitamins really help to help with the neurotransmitters for disease and cognition. This was just another one of the little tables in the book. Water. A lot of elderly people become dehydrated. They don't sit there and drink as much. They don't think that they're as active, so that they don't need that much water. Dehydration can cause confusion. Confusion can cause falls, and numerous amount of things. Fiber constipation increases with low intake and changes in the GI tract. Protein, vitamin B12, calcium, all things that we've talked about before, but this is the one that I liked. Through the lips, past the gums, look out gut, here it comes. Elderly people take a lot more medications. So like with the constipation, they're not getting as much, if they're on Lasix and stuff like that, they don't want to drink water as much. They think it's going to make them go to the bathroom all day. They don't want to do stuff like that. But that's not the point of it. Part of the medications that they take, because they're elderly, the way that their body absorbs, distributes, metabolizes, and eliminates medications, it's a lot different than in a young adult. Some medications, their peak onset, it's a lot longer than a typical young adult would be. Some side effects, nausea, constipation, urinary retention, sedation. You know, if you're nauseous, you're not going to want to eat. If you're constipated, you're not going to want to move, exercise. You're not getting the nutrients that you need. And those are all things that you need to be aware of and tell the patient. I found that on the opiates and elderly use and side effects. It was an article I read one time. Okay, for the determined checklist, I spent some time in the emergency department at the hospital and at the Center for Mental Health building, and I run data analysis. And some of the things that we do is when we look at the consultations with patients, if they don't get assessed, they ask why. If UTA, unable to assess, defer, they're confused, poor historian. So if you have a patient like that, and it's going to happen, you still need to gather information about them. And something that I had read was looking through past charts can help you to do disease, see what their diagnosis is. Eating poorly, well, if you look at their weight when they come in and maybe their past one, they might be losing weight, and you can see the timeline. Tooth loss, just have to look at them, but I don't think the chart would say that. Reduce social contact. I think that one might come down a little bit more just because people are getting older now, and that population, like it said, 70 or 85 years and older. So you have like those friends that are with you still. Medications, it talked about. taking so many more medications and the side effects. The involuntary weight loss, that could do with the poor eating as well, and their age you can find from their chart. So those are things that I think are important to be able to look at when you're trying to do a determined assessment. But obviously if the patient is a good historian, if you can ask them questions, then they can answer you, and you can determine their risk factors. That's it.